Hello and welcome to Teens and Young Adults with Lupus, Transitioning to Adult Care. I'm Annika Hazlitt, a member of the Board of Directors of Kaleidoscope Fighting Lupus, and your host. It can be make or break time when young adults with child-onset lupus move from pediatric to adult rheumatology care. Far too many get lost in the transition or stop their treatments altogether, putting their health at serious risk. Here to shine a light on this difficult time and to share some awesome advice on how to successfully make the transition is one of our favorites, Dr. Megan Lockwood, clinical rheumatologist, director of the lupus program at Medstar Georgetown University Hospital, and assistant professor of medicine at Georgetown University. Before we hear from Dr. Lockwood, I'd like to thank our presenting sponsor, GSK, for their generous support in making this educational video possible. I would also like to thank our community sponsors, Blue Eyed Crow Studio, Tin Rocket, 7 Minute Cinemas, and Due North Studios for their support. Now, let's hear from Dr. Lockwood.
Well, thank you so much for having me today. I'm delighted to be here to talk about this important topic on teens with lupus and transitioning to adult care. So what is the transition? The transition is really a purposeful, planned movement of adolescents and young adults with chronic physical and medical conditions from child-centered to adult-centered healthcare systems. And today, I want to share with you some of the key differences between pediatric and adult rheumatology to help get you familiar with this transition. This is based off of work that has been published extensively by our pediatric colleagues, particularly the Peds Rheum group at Duke, which I have found immensely helpful as I learned to navigate these transitions as an adult rheumatologist. We can think of the differences between pediatric and adult practices in 4 broad categories. There are philosophical differences, there are differences in policies and procedures, there's differences in the clinical care, as well as the clinical setting. So let's start with the philosophical differences. A key philosophical difference between Peds Rheum and adult rheum is really the distinction between family-centered orientation of pediatrics and the patient-centered culture of adult internal medicine. Really at the heart of a pediatric rheumatology visit is a family-centered interaction in which the patient, the parent, and the provider work together to address the patient's medical needs. This is really in contrast to what we do in rheumatology as adults, where these tend to be more one-on-one exchanges between the patient and the provider. The involvement of a guardian at the pediatric visit decreases the pressure on the patient to raise their own questions and to provide those answers, and it tends to foster a collective decision-making process. So it can be a particular challenge when a patient transitions to an adult clinic because all of a sudden there's new responsibilities such as self-advocacy and self-management, which can feel really overwhelming. Patients in pediatric rheumatology are routinely invited to discuss their hobbies, educational goals, and vocational interests, whereas due to time constraints, most of the visits in the adult rheumatology clinic are most likely focused on conversations surrounding their disease and treatment. For the pediatrician, learning about their patient's interests and aspirations is important not only to connect with their patient, but can also provide really helpful information about the patient's disease activity, since changes in school performance and ability to participate in their favorite activities can provide important clues to their health status. This can be a particular challenge when transitioning to adult rheumatology because there's not always the same amount of time to discuss your life and interest outside of your disease. And therefore, many young adults report this being a real barrier to the development of a trusting and lasting relationship with their new adult providers. In addition to cultural and philosophical differences, there are also just going to be structural differences between the pediatric clinic and the rheumatology clinic. So, pediatric rheumatology visits are typically much longer, and there's more time allotted in the return visits in particular, so that the provider can get a history from both the patient and the parent, conduct a full physical exam, and to really assess how the patient is doing socially, emotionally, and academically. However, adult rheumatology clinic visits, especially return visits, do often not have this time and typically run between 10 and 20 minutes. And without being privy to the length of the appointment slot with the adult provider, many young adults may develop this impression that their adult rheumatologist is unengaged, hurried, or even uncaring. In pediatrics, there's also significant leniency shown toward patients who arrive late to clinic visits. And part of this is because it's recognized that punctuality is really in the hands of the parents and not the patient. Unfortunately, an unintended consequence of this is that many patients and their families may get more comfortable with the idea that they will be seen by the provider regardless of what time they arrive. This can be a real change when you come to an adult rheumatology clinic, because in that setting, patients are much more likely to be held accountable for their tardiness to demonstrate fairness to the other patients. And oftentimes, a patient who arrives late to their adult clinic will be asked to reschedule, and someone with repeated no shows may actually be discharged from the clinic. Clinical care is another key difference between the practices of pediatric rheumatologists and adult rheumatologists. And often these differences are very apparent to our young adults and their families who really grow accustomed to a certain routine and will note a stark contrast after transferring to adult care. Nearly every pediatric visit will include a full musculoskeletal exam, regardless of any active complaints. Whereas in the adult clinic, the physical exam tends to be much more targeted based on the patient's history and what their concerns are that day. The provider may choose to examine only the joints deemed most pertinent that day. And this practice difference may stem, at least in part, from the fact that younger children may be less attuned to their joint symptoms or less able to really clearly articulate what they're feeling. When patients transition from pediatric to adult care, they may consider that abbreviated exam to be perfunctory and perceive that the adult rheumatologist is providing suboptimal care. Another key difference between pediatric and adult rheumatology practice is that in pediatric rheumatology, the emphasis is really on achieving inactive disease, whereas in many circumstances, in adult rheumatology, we tend to tolerate minimal disease activity so long as it doesn't interfere with any function. In pediatric rheumatology, there is a real emphasis for remission because even subtle inflammation in a joint with an open growth plate can actually lead to premature fusion of the growth plate and create leg length discrepancies and other long-term deformities as an adult. In addition, after a period of inactive disease on immunosuppressive therapy, many pediatric patients are able to wean off of their medications. So, in light of the pediatric rheumatologist's insistence on no disease activity, in adult rheumatology, we often tolerate minimal residual disease activity that can take our younger patients by surprise. Shared decision making about treatment options can really increase the patient's confidence in their adult rheumatologist. One of the most striking differences between the pediatric and rheumatology clinic relates to how the provider handles poor medication adherence. Adult rheumatologists make efforts to support medication adherence, such as reducing pill burden, but ultimately holds the patient accountable for taking their own medications. Pediatric rheumatology generally has a different approach. And in pediatric rheumatology, you may get intravenous medications for children who aren't able to take pills. In kids, we also know that the frontal lobe is not fully developed until approximately the age of 24. And so many pediatric providers will make accommodations for adolescents and young adults who struggle with executive functions, including consideration of future consequences. So finally, in the patients that are transitioning from the pediatric clinic to the adult clinic, you'll often notice different resources available in the adult rheumatology clinic. Resource differences are often magnified if a young adult transfers from a pediatric rheumatology clinic at an academic medical center to a more smaller private practice adult rheumatology office. So, a child entering a pediatric clinic is typically met with a brightly colored office space, games to play with during the visit, and many activities. An adult clinic, in contrast, is much more likely to have bare walls and few, if any, specific elements intended to provide comfort or entertainment. Patients often comment on the starker adult clinic environment and that it feels harsh when they first transfer to the adult setting, which can actually result in some apprehensiveness about the visit. And for patients with rheumatic conditions that require multidisciplinary care, so care from different types of specialists and providers, these coordinated clinics are very common on the pediatric side. So, for example, a pediatric patient with lupus nephritis may be seen in a combined rheumatology nephrology clinic. Patients who lose access to these multidisciplinary clinics as they transition to adult rheumatology may perceive that their care is fragmented and may have an increased number of no-shows as they really start to struggle to navigate the increased number of appointments. Attempts by an adult rheumatology office to group appointments with other specialists on the same day can be very helpful, but this is often not feasible. Pediatric rheumatology clinics also commonly feature a team of social workers, physical therapists, occupational therapists, and/or child life specialists to improve rheumatologic care and overall well-being of patients. So, for example, social workers in the pediatric rheumatology clinic are trained to provide emotional support to children living with chronic illness, to promote medication adherence, to help with transportation to and from the visit, and encourage formal psychiatric care when appropriate. Adult rheumatology clinics very rarely have a dedicated on-site social worker and will typically refer people to outside clinics or online resources on an as-needed basis for things like physical therapy and other ancillary services. So as a result, many of our young adult patients transitioning from pediatric to adult rheumatologic care can actually perceive a void and really can benefit from early referrals to ancillary services and direct assistance in building their own multidisciplinary teams and identifying a point person or navigator who can help them with questions. So how can you start preparing for this transition? These conversations can start early. If you're a teenager out there with lupus, I encourage you to start asking your pediatric rheumatologist about this. This isn't something that should happen overnight. It's really a good idea to start planning your transition while you're in high school and still have a safety net. That way, after graduation, you'll already have experience with independently managing your healthcare. I like to think of this like driving a car. You don't just get handed the keys and expect to be able to drive without any supervision on day one. Instead, there's going to be a transition period where you take driver's education, where you read the driver's manual, and then you get one-on-one practice behind the wheel. We know that people cannot safely drive on the freeway in your first hour behind the wheel. It's a new skill that you have to work up to after mastering easier skills and with an adult driver sitting alongside next to you to offer feedback and assist as necessary. So just as it would be dangerous for someone to drive independently without the training and practice that leads to a driver's license, it would be dangerous for a young adult to leave for college or other independent living opportunities before they have really practiced self-management skills, such as medication management in a safe environment. So how can you prepare for this transition? The first place to start is to take a self-assessment on the management of your own health. I'm going to share with you some skills that come from a commonly used readiness questionnaire by pediatric rheumatologists, and I want you to start asking yourself these questions. Do I know how to do this skill? Do I want to learn how to do this skill? Am I actively learning this skill right now? Have I already started doing this skill? Or is this something I always do when I need to do? So first is managing medications. And the questions I want you to ask yourself: do you fill a prescription when you need to? Do you know what to do if you are having a bad reaction to your medications? Do you take medications correctly and on your own? Do you reorder your medications before they run out? And moving on to appointment keeping. Do you call your doctor's office to make an appointment? Do you follow up on any referrals or tests that were ordered at the last visit? Do you arrange for your transportation to your medical appointments? Do you call the doctor about unusual changes in your health, such as an allergic reaction? Do you know what your health insurance covers? In terms of tracking health issues, do you fill out the medical history form, including a list of your allergies? Do you keep a calendar or a list of your medical appointments? Do you keep a list of your medications? Do you make a list of questions before the doctor's visits? And when talking to your providers, do you tell the doctor or nurse what you're feeling? Do you answer questions that are asked by the doctor, nurse, or clinic staff? When it comes to managing daily activities, do you help to plan or prepare your own meals? Do you keep your room clean and clean up after your meals? Do you use neighborhood stores and services such as grocery stores and pharmacies? These are all questions to start asking yourself to help determine how ready you are for the transition. So when you're starting these conversations with your own provider, you can slowly start to take over some key parts of your healthcare. Your answers to the previous questions can help you and your doctor to identify areas to work on as you prepare for your transition. Here are some tips. Keep a lupus journal to keep track of your health and treatment. For example, how often do you flare? What are possible triggers? What are side effects of medications that you've experienced? Organize your medications with the help of your parents and ask your parents and your doctors to clearly explain to you what each medication does and why it's important that you take it every day or however it is prescribed. Start to schedule your own appointments. Begin to manage various aspects of your healthcare. So that can be making doctor's appointments, refilling your own prescriptions, scheduling lab tests, etc. As you start to develop a role in the management of your disease, then you can get a better sense of the responsibilities that come with self-care. Ask your doctors to begin to speak to you directly rather than channeling the information through your parent. As you get older, you need to feel that your opinion is important in the decision-making process. And this also helps you to experience some degree of control over your lupus, as well as realize the impact of your choices. And finally, think about developing a relationship with your pharmacist or your local pharmacy. If you move away, it is likely that there will be a transfer of prescriptions. Having a close relationship will help to facilitate that process and ensure that your prescriptions are up to date and accounted for. The more you understand lupus and the healthcare system, the more successful you will be at living with a chronic illness in adulthood. So in summary, there are several differences between your experience in the pediatric rheumatology clinic compared to the adult rheumatology clinic. I encourage you to start thinking about this transition early and assess your own level of readiness. And finally, don't be afraid to assert yourself and ask for help. Thank you again so much for joining me today, and a special thank you to Kaleidoscope Fighting Lupus for providing these amazing resources.
Thank you, Dr. Lockwood, for giving such clear and compassionate advice. We hope you found teens and young adults with lupus transitioning to adult care helpful, and please share this video with others. Once again, a special thanks to our presenting sponsor, GSK, for their dedicated support in making this presentation possible. You can find more great lupus resources on GSK's Us in Lupus website by using this QR code. Thanks as well to our community sponsors, Blue Eyed Crow Studio, Tin Rocket, 7 Minute Cinemas, and Due North Studios for their incredible support. And we want to thank you for watching. We encourage you to visit our website, kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, program information, award-winning blog articles, and so much more. Thanks for spending time with us. And remember, you are not alone. I'm Annika Hazlitt for Kaleidoscope Fighting Lupus. Please, take care.